Hey guys, welcome back to my channel. I am Yogita Modi. Today I am going to teach you about aneurysm. We will cover this aneurysm in the topic like what are the definition, what are the classifications, what are the predisposing factor of the aneurysm, and what are the pathogenesis, okay, what are the consequences, and we will discuss the other type of aneurysm also like abdominal aortic aneurysm, thoracic aortic aneurysm, and syphilitic aneurysm. I prepared these notes for you guys and I'll share this slide on my Telegram channel also so you will easily get my notes and prepare for your exam. Okay, so we'll discuss aneurysm. Definition is a congenital, okay, and acquired. This is localized abnormal permanent dilatation of the arterial wall. So there is a five word. Okay, first there is a congenital or acquired. Okay, third is localized, fourth is abnormal, and fifth is permanent dilatation. Okay, so this is the definition of the aneurysm. Now discuss the classification. The aneurysm is classified according to the origin of aneurysm, location of the aneurysm, gross appearance of the aneurysm also, what are the composition of the involved wall, okay, and etiological factor also, okay. So there is a origin. Origin there will can be acquired or congenital, okay, and in location it can be arterial, it can be venous, or it can be present in the heart, okay, and according to the gross appearance. Okay, gross appearance basically will say size and shape. Okay, so it can be fusiform like this, the small dilatation. Okay, and circular there will be the small bulging type. Okay, third is cylindrical there will the involve the whole circumference of the vessel wall. Okay, and there is a arterial dissection also called as aneurysm because there is also a permanent and localized dilatation, okay, so it can also involve in the aneurysm. Okay, now it is divided according to the composition of the involved wall. Okay, so the composition will be like if it is true aneurysm like it involve all the wall, okay, or it can be false aneurysm. So this is the pulsating aneurysm present in the hematoma. Okay, this is not true aneurysm. This is not a true aneurysm because there is not like properly involvement of the arterial wall. Okay, and there is a arterial dissection because arterial dissection is a accumulation of the blood between the vessel wall and it get dilated into the lumen, not outside the lumen. Okay, so it is also one type of the aneurysm. So this is a non-pulsatile aneurysm. Okay, then etiological. Etiological there will be a mnemonics A, B, C, D, and P. Okay, so the atherosclerotic aneurysm. Okay, this is the most common type of the aneurysm. Then we are having the Berry aneurysm. Berry aneurysm is basically present in the circle of villus of the brain. Okay, and then meiotic aneurysm. Meiotic aneurysm, this is basically present in the microbial infection condition. Okay, then dissecting aneurysm. Dissecting aneurysm, there is a general phenomena when the hypertension is occurring and arterial wall is very thin and it's get like separated between the arterial wall and get accumulate the blood, so it will also cause the aneurysm. Okay, and the fifth type is syphiliticus aneurysm. The syphiliticus aneurysm is present mainly in the tertiary stage of the syphilis infection. Okay, so these are the classification of the aneurysm. Now come on the pathogenesis of the aneurysm. The pathogenesis will be inadequate synthesis of the connective tissue. Yeah, mainly what happened in the aneurysm, there is all weakening of the arterial wall and dilatation of the arterial wall. Okay, so it can be inadequate synthesis of the connective tissue. Okay, and second will be the increasing the degradation of the connective tissue. These both are factors favorable for the um, like thinning of the arterial wall. Okay, so firstly we'll discuss the inadequate synthesis of the connective tissue. Inadequate synthesis of the connective tissue. So there will be a tissue growth factor beta that is regulate the smooth muscle cell proliferation and synthesis of the connective tissue. So there is a mutation in this gene that alter the connective tissue formation and cause the aneurysm. This fiber will be the elastin or collagen. These are the main composition of the arterial wall, which is help to maintain the whole shape of the artery. Okay, so we will write there is a tissue growth factor beta gene that regulates the smooth muscle cell proliferation and synthesis of the connective tissue. So there will be a mutation, okay, that can alter the formation of the connective tissue and cause the aneurysm. Okay, so there is a example like मार्फन सिंड्रोम. मार्फन सिंड्रोम में क्या होता है? There is an inadequate fibrillin synthesis. Okay, so this is the main cause. Then Ehlers Danlos syndrome. There is a inadequate collagen type 3. Okay, type 3 synthesis. Then vitamin C deficiency. There is a loss of cross link between the collagen. This is also responsible for the weakening of the wall. Okay. Now second is the increasing the degradation of the connective tissue. Okay. Increasing the MMP enzyme, that means matrix metalloproteinase by the macrophage. Okay, so this is the mainly responsible for the degradation of the connective tissue, and this tissue convert into aneurysm. Okay, so this is increasing the degradation. Okay, now come on the second part. Inflammatory condition, there is a decrease the tissue inhibitor metalloprotein. Okay, and increasing the matrix metalloprotein. So basically यहाँ पे क्या बोल रहा है कि in the inflammation there is a decreasing of tissue inhibitors metalloproteinase. Okay, and increasing of the matrix metalloproteinase. Okay, so there is a 2 point. First is this and second is this. Okay, you can easily understand this. Then loss of the smooth muscle cell in the media due to an ischemia. Okay, so aneurysm is also present in the hypertension or in the obstruction occlusion. So there can be ischemia in somewhere of the arterial wall. So okay, so it also cause the smooth muscle thinning and degradation and flabby smooth muscle cell. Okay, so it is also responsible for the weakening of the arterial wall. Okay, loss of the smooth muscle cell in the media due to the ischemia. Okay, so this is the I found this diagram for you. So there is a major site of the formation of the aneurysm. Okay, so the sclerotic aneurysm is mainly caused in these three sites. Okay, because of there is a alter the blood flow. Okay, this is also there is also okay. So this is the mainly cause for the atherosclerotic aneurysm. Okay. Now second is meiotic. Meiotic, there is only one side. There is a bacterial accumulation. Okay. Then syphilitic. Syphilitic, there is a two side. Okay. Then dissecting aneurysm. Dissecting aneurysm, there will be present on the descending arch of the aorta. Okay. And we can see this berry aneurysm. This is present in the circle of the villus of the brain. Okay. Then now come on the predisposing factor. Okay. So the predisposing factor will be atherosclerosis. Obviously, atherosclerosis causing the aneurysm, hypertension, yes, increasing the perivascular resistance, that increasing the BP, and also there is also the excessive dilatation of the arterial wall or increasing the tension in the arterial wall that cause the rupture of the arterial wall. Okay, in the trauma and vasculitis, there is a bacterial infection or viral infection that is also responsible for the weakening of the arterial wall. See, there is a fungal infection and bacterial infection. What are the main fungus and bacteria that infect the blood vessels and causing the aneurysm? So the fungus will be mucor and candidiasis and aspergillus, and bacteria will be salmonella. Okay, then there is a congenital disease. Yes, this is the inborn disease. So it can be caused. Okay, and then tertiary syphilis infection. Okay, these are the predisposing factor for the aneurysm. Now we will discuss the abdominal aortic aneurysm, which is also called as the triple A. Okay, so the risk factor related to the age and gender. Okay, cause also atherosclerosis is a major cause. Okay, now so we forgot to discuss here aneurysm. The risk factor will be age related or gender related. Like age above the 15 is main common. Okay, male has a main common abdominal aortic aneurysm and smoker has a higher risk for the abdominal aortic aneurysm. Okay, main causes the atherosclerosis. In the atherosclerosis is a more frequent condition in the elderly age, so it can be. Then like atherosclerosis of the abdominal aorta, there is a decreasing the formation of the extracellular matrix and increasing the degradation, as we discussed earlier. That is same. And inflammatory abdominal aortic aneurysm. In the inflammation, releasing of the matrix metalloproteinase that degrade the connective tissue. Okay. Then meiotic abdominal aorta aneurysm is the circulating organism, microorganism that infect the arterial wall and causing the weakening of the wall. Okay. Now, what are the clinical features and complication of the aneurysm? So the clinical features will be rupture, thrombus formation, embolism, and compression of the ureter outflow. Okay. So, what will be the rupture? Like rupture in the retroperitoneal and peritoneal cavity, that blood leak in the peritoneal cavity. Okay, and forming the pus. Thrombus, there can be the ischemia to the organ. Okay, fragment of the mural thrombi and atherosclerotic plug. What is the embolism? Embolism is a fragment of the clotted blood or clot. Okay, that is called as thrombi and atherosclerotic plug that causing the embolism. Embolism is a basically movable thrombus that can uh, move in the arteria, that can move in the vessels and get accumulate in the very small micro vessels and get accumulate and cause the ischemia to the organ. Compression of the ureter. So there is a mainly abdominal aortic aneurysm. Na? So the aneurysm is a dilatation of the artery, and the ureter will be present behind to the this aorta, and there is a dilatation of the aorta that causing the uh, ureter compression, and this is also responsible for the oligouria as well as abdominal pain and um, renal cell carcinoma and also enlarged kidney. Okay, then morphology of the abdominal aortic aneurysm. So the site will be the below the renal artery and bifurcation of the aorta, because there is a mainly bifurcation and the uh, change in the blood flow that causing the accumulation of the um, microbes and responsible for the weakening of the arterial wall and causing the aneurysm. Okay, size will be the 10 to 25 centimeter, and the shape will be the fusiform or circular. So you can see here, this is the example of the abdominal aortic aneurysm. Okay, so you can easily see this is the abdominal aorta. Okay, this is the bifurcation. You can see these two, right and left iliac. So this is the aneurysm. You can see this bulging, and there is a rupture of the aneurysm. Okay. So we cut this aneurysm like this, and now we can see how much thickening this aneurysm has. Okay, and this is the clotted blood. Okay, these are the blood clot that present. So this is the abdominal aortic aneurysm. So the thoracic aorta aneurysm main cause will be the hypertension. Okay, and before going to the acute plug change, okay, this is the over. Now there is a some sign that you can easily make out what are the like complication patient has. Okay, so there is a before going to the acute plug change, there will be the patient has a chest pain. Okay, the chest pain will be because of the um, coronary artery compression. Okay, then difficulty in swelling because compression of the esophagus. Okay, and harshness of the voice and cough because of the compression of the recurrent laryngeal nerve. Then difficulty in respiration and pain in bone because of there is a erosion of the bone also. Okay, so these are the factors that can easily make out the patient might be have the aneurysm. Okay, and patient is might be going under the acute plaque change that can cause the other atherosclerotic complication as well as dissection, aortic dissection and the aneurysm. Okay, and the other complication will be the valvular insufficiency, regurgitation, and rupture and dilatation. Okay, rupture and dilatation is the main common. Valvular insufficiency and regurgitation is mainly present in the when the aneurysm present within the heart. Okay, now come on the syphiliticus aneurysm. The syphilitis aneurysm present in the tertiary stage of the syphilis infection. Okay, so there is a syphilis that can cause aneurysm and aortitis. Okay, site will be the ascending aorta. Morphology will be the this is called endocarditis. This is called endoarteritis, periarteritis, and vasorum. The morphology will be it can cause endoarteritis, periarteritis of the vasorum. What is the vasorum? This is the small blood vessel that supply to the vein and artery. Okay, and also supply to the heart, coronary artery also. So the obliteration of the vasa vasorum, okay, that can cause the ischemia to this respected artery. Okay, and if the ischemia is there, the all other complication like uh, necrosis, weakening, thinning, thrombus, atherosclerosis, all are the present. Okay, and there is a medial scar. Medial scar, how it is appear? Okay, this is medial scar like tree bark appearance. Okay, so describe about the how the syphilitis aneurysm is present. Okay, so this is all about the aneurysm.